Good morning and welcome back. Well, September is Pediatric Cancer Awareness Month, and joining us to talk a little bit about this I guess all-encompassing term for a number of diseases is pediatric oncologist from Gundersen, Dr. Toni Peters. Dr. Peters, thanks for waking up with us this morning.
Thank you for having me. It's good to be here.
So as I mentioned, childhood cancer kind of is a blanket term for a number of different diseases. What are some of the common forms of cancer that affect kids?
Yeah, certainly the most common kind we see is acute lymphoblastic leukemia that affects about 3,000 kids per year in the United States. Some other tumors you might hear about in children would be one called neuroblastoma. We also see bone tumors and brain tumors. Those are some of the most common types of cancers we see in children.
Are we seeing these cancers, in utero when they're still in their mother's womb, or are we seeing them more when they come to term and as they're getting older?
It's very unusual for children to be born with cancer. That's very rare, and actually it's rare for cancer to be diagnosed in the first year of life. We see cancers diagnosed most typically in the preschool years. When kids are between 3 and 5 years of age, and then there's another sort of spike again when kids are in their adolescent or teenage years.
Do we have any sort of, I guess, indicators as to how these cancers develop in kids as far as, is it something that's behavioral, environmental, or is it something that's genetic that they inherit from their parents?
Yeah, that's a great question. There are a few families where we know there are hereditary causes, which of course is a very scary and unfortunate thing, but and as a general rule, we don't, unlike adult cancers where, you can say, unfortunately this was due to your years of smoking, or we know obesity may play a role. As a general rule, in pediatric cancers, we really haven't been able to pinpoint the exact cause, which is one of the things research has really been focused on. But unfortunately, we really haven't been able to pinpoint the exact cause, which is, we usually just tell the parents, and the child, this is just really bad luck. This is not anything you did. This is not from eating too many hot dogs, that sort of thing.
Which can be tough to explain to a kid. And really quick before we go, Dr. Peters, I just want to touch upon survival rates and that kids do have a fighting chance.
Yeah, absolutely. For most childhood cancers, when the patient walks through the door, we really improve survival rates, and kids nowadays, we cure more than 80% of childhood cancers. And for certain types of cancers, for instance, lymphoblastic leukemia, certain types, the survival rates are 95% or better. So we're really doing quite well with childhood cancers.
Good to hear.
But there's always room for improvement.
Always is. Dr. Peters, thank you so much for joining us this morning.